things we don't want to talk about but should. This is an odd way to end the talk, but patients with severe idiopathic pulmonary fibrosis, if mechanical ventilation is involved, it's not common that they will survive, with a big exception. If there's a pneumonia that comes up or something like that that can be easily treatable, it's often times reversible. But if it's just the disease that's progressing, it can be very hard to ever come off the breathing machine. I think it's a very good idea to have discussions about what someone who has pulmonary fibrosis or any other medical condition, or even people that are in totally good health, what they're okay with and what they're not. And I'm a fan of the 5 Wishes campaign that's on the internet, which basically is a forum that lets you say, if I'm ever really sick, these are things that are important to me. And it may even be, I would like music playing in the background when I'm in the ICU. But all those things can make a huge difference just from being there day to day. Someone who is doing terribly in a coma and music is playing, and you can see that they hear it in that state, and that their day's made a little bit easier. So I know it's not something that we like to think about, but the ICU part of me had to chip in. Odd note to end on, sorry for that, but I'm really grateful to have the chance to come here today. I talked a little longer than I wanted, but I'll be very, very glad to answer any questions people have. Yes, yeah. So that's a really great question. So this is specific for someone who has rheumatoid arthritis and pulmonary fibrosis related to that. One of the trickiest things about rheumatoid arthritis is just about every medicine that's used to treat it makes that list of drugs that can cause pulmonary fibrosis. And unfortunately, some people with rheumatoid arthritis get pulmonary fibrosis. So then, if you've been told you have pulmonary fibrosis and then you're being offered all these medications, how do you know if you should take them or not because of the risk that it could make pulmonary fibrosis worse? And that is a really good question. I don't think there's anyone who just outright knows the answer to that. I think in general, methotrexate is the one that's most linked with pulmonary fibrosis. So if there's someone who's on methotrexate and pulmonary fibrosis seems to get any worse, usually a rheumatologist will stop that and pursue something different like Remicade or something like that. The monoclonal antibodies for rheumatoid arthritis like Remicade and several others are not quite as associated with the pulmonary fibrosis in general. That's a much lower risk. So in general, I think of those as being less likely than methotrexate. Yes, sir?
Yeah, I have a question about coughing up mucus. I've had the doctor say, well, you'll be coughing and they'll ask me something. But I've noticed here recently, in the last 4 or 5 weeks, I've been more mucus, just coughing it up from, and it's been, thick. Does that have any significance on anything about the disease itself?
So the question is, I have pulmonary fibrosis, and in the last few weeks, my cough has gone from daily to a little more than that, bringing up more stuff. And is that increase in cough, is that significant for anything? The biggest thing that I'd say is when you have pulmonary fibrosis, those airways that are going out, there's one picture on a CT scan that showed an airway that's dilated. And I mentioned the term bronchiectasis and the traction on it. If you have that, if you have enlargement of the airways, it makes it harder to get secretions up. And that can set up for a secondary infection. So it's not uncommon if someone with pulmonary fibrosis develops a cough that increases and that either the color of the sputum changes or the amount of sputum increases to take a short course of antibiotic just in case, and sometimes that comes with a sputum sample where you'll give a sample of it and they'll look for bacteria and give you a brief course of an antibiotic just to make sure that there's no infection that's setting up as a result of that. There's nothing that says that an increased cough for a couple of weeks necessarily means pulmonary fibrosis is progressing or breaking through. Yes?
What is the connection between fibrosis and pulmonary hypertension?
Great question. What is the connection between fibrosis and pulmonary hypertension? So we have to leave the world of pulmonary fibrosis and come into the very different world of pulmonary hypertension, the blood vessels going throughout the lungs. Pulmonary hypertension has several different types. And one of the types is pulmonary, well, wouldn't be surprised today, idiopathic pulmonary hypertension. One of the groups is when the high blood pressure in the lungs is just caused by a problem in the blood vessels of the lungs. But with pulmonary fibrosis, the way it's categorized is pulmonary hypertension secondary to pulmonary fibrosis usually. What that means is that the pulmonary fibrosis creates an environment where the blood vessels constrict and blood pressure goes up. Sometimes it's that the blood vessels are directly involved because they're part of that interstitium. And one of the hot topics right now is, can the pulmonary hypertension associated with fibrosis be treated with some of the medicines that are used to treat pulmonary hypertension, idiopathic pulmonary hypertension? It's not generally accepted yet, so that's a frustrating thing. Every now and then I'll meet someone who has pulmonary fibrosis and pulmonary hypertension related to it. I'll prescribe a medicine for pulmonary hypertension, and we'll send the referral in, and insurance will come back and say, no, this is not FDA approved for people that have it due to pulmonary fibrosis, and that's a really frustrating scenario. So that's, I guess, in a nutshell, we say it's pulmonary hypertension secondary to pulmonary fibrosis.
So what causes what?
It's the pulmonary fibrosis that drives the pulmonary hypertension. Yes.
Previously, you said that the going in and taking a sample of the lung is not such a good idea.
Not necessarily. What I meant to say was that it's an individual decision. That there are certain people where taking a sample of the lung is the right thing to do, what I recommend doing. There are other people where it seems more cut and dry without it, and then the risk of the procedure is not outweighed by the benefit.
And the second part of this question, whenever my doctor went into my lungs, he sucked out all the mucus. Okay, he put the water in and sucked out the water and sent it off. Okay, why does it take so long to get the results back?
Good question. So the doctor did a procedure as part of the evaluation for fibrosis where he did a bronchoscopy, where a flexible scope is passed usually through the nose into the lungs. And then in an area where it's involved, fluid, just saline, is put in and then sucked back out. I thought about putting this in. I left it out. I should have put it in. But that saline that's sucked back out is sent to the lab. The importance of that fluid is to check for any infection. Because what if there's an infection that's there that's mimicking pulmonary fibrosis, that you don't need that diagnosis of pulmonary fibrosis. You need a diagnosis of that infection and treatment of it because they can overlap. But some of the infections that can mimic pulmonary fibrosis are slow-growing infections. It can take up to 6 weeks to grow in a lab, no matter where in the world it is, no matter whose lab, it's 6 weeks. So anyone that tells you they got a quick lab, it's not going to be.
So in my case, the best thing that could happen for me is to have the doctor find out that something's growing in there. It's not pulmonary fibrosis, it's an infection that he can treat as an infection.
Oh, well, it's possible. And again, with pulmonary fibrosis, everyone's different with this in terms of prognosis and how it develops over time. So, but that's why it takes so long to get those results back.
My bronchs have been because I aspergillus. And that what they're on for here?
That's one of the things. Aspergillus will grow back within a week or two. Now, MAC is going to take 6 weeks to grow back.
No, and I was put on Symbicort, and I don't see how Symbicort is going to help fibrosis. Maybe I'm just missing something.
The,
Is it supposed to open my lungs or something? What's it supposed to do?
well, Symbicort has 2 medicines in it. One is inhaled steroid that won't have the side effects that taking prednisone will. And the other is a long-acting beta agonist, a medicine that's like albuterol. It just gives a little dilatation. It's often helpful if anyone has like bronchiectasis or enlarged airways associated with the fibrosis. Sometimes it can really help with that. There may be things on the pulmonary function test that make a pulmonologist decide whether or not to try Symbicort or not to try Symbicort. So it's not necessarily a wrong thing to do.
Right, but it can't cause no problems, even though it is a steroid, right?
The only thing, rinse the mouth out well is
Right.
Symbicort and gargle the back of the throat.
I started gargling the second day after the first day.
Good.
It felt pretty lousy.